As many take sickle cell disease lightly, little is known that those with the disease inherited two sickle cell genes, with each from their parents. This is because many have not bothered to go for early screening before getting married or giving birth to children. But in order for one to reduce on the risk of passing on the genes to the children, early diagnosis of the disease is very important to avoid the complications, which can be prevented with early diagnosis and treatment.
The mom and dad, it is not one parent, it is not from the grandparents and it skips and it comes to the child. No, it has to be you, the mom and dad. If you carry the sickle cell gene and your partner, there is a chance that you bring the S gene and your partner brings the S gene and the child gets two. That two sickle cell gene, that's the disease. That's how it is passed on.
Alvin Mutebi, a warrior, says he learned about being a sickler in 2004 after going through a serious attack that almost claimed his life, and only a blood transfusion was the only thing that could save his life. Stigmatization was part of the big challenges in Mutebi's life, and thus, in a chest to be open to his fellow schoolmates, Mutebi did not lean back from telling his friends, who thought he was using the disease to dodge school, that he had sickle cell anemia. Last month, Health Minister Jen Acheng cautioned schools to create awareness about the sickle cell disease in order to help in the stigmatization fight in schools, and also inform parents that sickle cell disease is not curable, just like HIV/AIDS.
When sickle cell disease is taught to these pupils and the students, it is extremely useful because then it gives them information about the disease, how it is got, and more importantly, why they should not stigmatize the children who have it, but rather support them. The treatment actually exists. The hydroxyurea. It is here in Uganda.
Understand what you must do at home. That is prevention. Feeding them right, using a lot of fruits and vegetables and high proteins and body-building foods. Signs and symptoms that come from the age of around 6 months. From around 6 months, the children start to swell their fingers and feet. It could be 2 fingers, it could be the whole palm, it could be the whole foot. That's one of the signs and symptoms of sickle cell. And then they get the yellow eyes.
Screening services for the sickle cell disease threats is currently available in hospitals across the country, and this intervention has since seen a rise in awareness about the purpose of screening from 2% to 30%. Philip Mwebaza, this is my story.